Hi, I'm Lisa, and I wanted to do a video about my first round of chemotherapy. I was recently diagnosed with cancer on September 14th of this year, 2024, and now it's November, so it's almost been 2 months, and I just started the chemo about a week and a half ago. So I just wanted to tell you how it's going and just in case you have this coming up in your life and you don't know what to expect because I really didn't know what to expect. So I have stage 3 cancer, by the way. So before I was able to get my treatment that day, first I had to go and get a PICC line inserted in my arm. So that's something that's a it's like an IV that's going to stay in my arm for maybe about 6 months, and that's so that each time that I go for a treatment, or if I was to need a blood transfusion or any other kind of medication, or I had an emergency, then I don't have to be poked each time. They don't have to keep, starting a line in my arm. So I will show you what that's like. So yeah, it's called the PICC line. Right now, I don't have any medication attached to it. I just got this redressed today, so I have to go once a week to get them to look at it and dress it. So it looks pretty nice right now. It's a little bit itchy for me around it actually. And when I got it dressed today, I saw that that is coming out just a little bit, and the nurse who dressed it said not to worry about it, but I'm going to bring that up at the hospital just because I'm kind of obsessing over it now. Hoping that it's not a problem. And now I'm a little bit worried that it's going to come out even more. Um, I really have been trying to follow the rules about not lifting more than 10 pounds, and I'm really trying to use my other hand more frequently. So this arm, I could take care of it. Now I'm more committed to doing that even. So this thing is called a sleeve. So you just cover it up and it just keeps everything nice and secure in there. So, it it won't get it won't get pulled on or come off or anything like that. It is November here, like I said, in Canada, so it's getting cold. So I'm wearing long sleeves every day. I just wore this for the purpose of the video, just so I could show it off. And I actually prefer wearing or long sleeves anyways, because I don't really want to draw attention to it. But when I go to my appointments, then I am wearing short sleeves just so that like the ease of access there. So that's my PICC line. Like I said, yeah, see, it's a little bit itchy right now. I have to take a lot of care with it. Like I said, showering is a little bit of an ordeal. I'm getting a little bit better at it, but you're not supposed to get this wet at all because there's risk of infection. So when I have a shower, I have to cover it up with a bag or a saran wrap. I usually put actually like a face cloth covering it, and then I'll put a bag and I'll tie it up. I've tried taping it, but the tape doesn't really stay on very well. I actually put scrunchies, like hair scrunchies, to kind of keep the bag on, or if I do saran wrap. But anyways, like I said, I'm actually getting better at keeping it dry. But yeah, mostly it's not really bothering me very much. It's just something I have to remain conscious of. And like I said, a few minutes ago, since I saw that it's just slightly coming out, I'm really gonna try to take more care with it going forward, even though I feel like I have. But anyways, it doesn't really bother me too much. So I had to get that done before I could get my first treatment. So after this was done, then I went to the chemotherapy floor. First, I had to stop by the pharmacy because there's some medication that you have to take 30 minutes to 1 hour before the treatment that can begin. It's mostly to prevent nausea for the treatment. So I did that, and then I was taken into the treatment room. There was a really, really wonderful nurse, just like so kind and lovely, and she was my nurse that day. So the room is like really big. There's lots of chairs. There's some window seats she showed me. I didn't get a window seat, but that was okay. And she took me to this chair. All of the chairs like are recliners, so you get to put your feet up. So I really appreciated that. And when I sat down, she gave me a warm blanket. Um, and then, so it was about 45 minutes to an hour after I was taken there before the treatment actually began. Took a lot for her to prepare, and she was asking me a lot of questions, and she was walking me through things. Hopefully, the next time that I go, it won't take quite so long for the treatment to begin. Um, and also, since the medication is so heavy duty, these are very strong drugs. They have to keep confirming with you your name and your birthday at so many different intervals to make sure that there's been no mistake. And before they turn the machine on, they get another nurse to come and to verify, who you are again with your name and your birthday, before they can turn it on. Not like the nurses don't know what they're doing, but it's just extra, they're taking extra steps to make sure that there's no mistake made. So I was on three different types of drugs. So I had like three different bags in the machine, and the whole thing took about 2.5 hours from when she turned the machine on. So the machine was attached to me the whole time. If I had to use the washroom, then the nurse showed me how to unplug the machine from the wall, and I had to drag it along on wheels with me to the washroom. The washroom is only for patients. You are allowed to bring visitor with you to the treatment for company, but if they need to use the washroom, they need to go elsewhere in the hospital because apparently it's not good to share a toilet with somebody who's undergoing chemotherapy. And everybody was instructed, male or female, that they had to sit on the toilet in case there's some splash or something like that, because then it's going to spread the medication. Because as you pee, then some of the medication comes out. And they also instruct you to flush the toilet twice when you're done. So that's something. So during the treatment, I didn't feel any different than from when I came in. That's what they told me. That if I was to feel differently in any way, that I was to tell them right away, because you're not supposed to feel any effects when you're getting the treatment. So I felt just completely fine. It was nice to put my feet up. I had somebody there with me, so we were talking. I was looking at my phone. The 2.5 hours actually went by pretty quickly. And then when that was finished, my treatment is such that after the portion at the cancer center, then they hook up something to my PIC line called an infuser pump. So that has a different type of medication that has to go through my system at a lot slower rate, over 48 hours. So the nurse hooked that up to me, and so it's like in a the infuser pump is in a bottle, and you're given this bag that's sort of like a purse that you put around, that volunteers have made. And so you have to carry the bottle around with you. So when you go home, you have to sleep with the bottle. You have to have the bottle with you at all times. It was a little tricky for me in the beginning because when I came home, I kept feeling like I had a purse on and I had to take my purse off. I wanted to keep lifting this bag off to take off the bottle, and so I had to remain conscious of it. But it wasn't too bad. It was like my little buddy, this bottle. And when I went to bed, I had to make sure that I positioned the bottle in a certain way so that it was safe, and I had to be careful that the tubing didn't become kinked or anything, so that the medication would go through. So after about 48 hours of that, um, I started my treatment on the Monday. So then around Wednesday afternoon is when the infuser pump is finished delivering the medication. So then you have to go and you have to get it disconnected, and again by a nurse. And you have to be very careful handling that. So when I was at the hospital and they were giving me the chemotherapy, and when they were disattaching detaching the infuser pump. The nurse had to wear a gown and gloves and everything. It's dangerous. They told me to turn my head and not breathe it in because it's dangerous, even though I am getting the medication in my body. Um, and so, yeah, care has to be taken with that bottle. You can't just throw it in the garbage. It has to be put in a special garbage and disposed of properly because it's a cytotoxin, which means that it's toxic to cells. So I was also instructed on what to do if the bottle was to break when I was at home, if it was to spill, if anything was to happen. I have a spill kit, so I have to clean it up in a certain way so that it doesn't affect those around me, which was a little bit worrisome to me because, there's some people that wanted to check on me, the guy that I'm seeing, and I was a little bit nervous because I didn't want to expose him to anything, um, any medication. So even when he came over to visit me, I told him I have two washrooms. So I said, this washroom I'm going to use, and this washroom you can use. And I was just really trying to be careful. So I am a little bit nervous about visiting family or friends in the future. Like if I'm putting them at risk going there and using their toilet. They say you could flush the toilet twice and it's okay, but I I'm still a little bit paranoid. I would never want to affect anybody negatively. So that's something that I'm I might just, when I have the infuser bottle, especially, just kind of isolate myself a little bit. Although even when you don't have the medication, even when you're not actively taking in the medication, there's still output from your body. I think up to 7 days. So that's something that's a little bit of a concern of mine. But anyways, so that was my treatment. How am I doing after round one? So after round one, I have experienced some things. So it's been kind of interesting to see how this was going to affect me. So the main thing that I've been feeling is just really tired. Um, excuse me. Well, the thing is, for about 2 years now, I have been feeling very tired, very fatigued, having some shortness of breath sometimes, because this cancer has been growing inside of me for a little while, and I didn't know it, but I knew that there was something wrong with me, especially because I was feeling so tired. So starting the chemotherapy, that's just increased a little bit, but I'm a little bit used to it. So that's a symptom that I'm feeling very tired, yawning a lot. I'm not necessarily having the deepest sleep every night, but I just do feel kind of, tired, low energy. Another thing that I've noticed is majorly is like a change in my appetite and my taste buds. A lot of things, they just don't sound like I want to eat them anymore. Are a lot of food just really turns me off when I have the thought of them. So I noticed I have been eating less. I've actually been drinking a lot less too. I don't feel like I'm really in the mood to drink, which isn't good because it's really important to not be dehydrated throughout this. So this is something that just dawned on me yesterday that over the course of the last few days, I haven't even had like a whole cup of something to drink besides coffee. But they say that coffee doesn't count because it's a diuretic. So they say when you're counting how much liquid that you've had, not to count coffee. So I have had coffee every morning, although I'm actually not enjoying the coffee lately, and I feel like it's starting to bother me a little bit. So that's interesting, and I'm going to see how it goes. And then I might consider cutting out coffee because that is something that I quit in the past. And I actually stopped coffee for quite a long time. And the reason why I started coffee again was when I was diagnosed with cancer, because I had a lot of appointments. When After the diagnosis, I had a lot of appointments. I had a lot of testing appointments. I had to get blood work quite a few times. I had to go for an MRI. I had to go for a CT scan. I had to go, meeting with different doctors. Um, there were a lot of early morning appointments, and at that time, I was working mostly like I was working afternoon shifts at work. So I would finish work at 11. I would come home. Sometimes, it took me a little while to go to bed. Sometimes I wouldn't be going to bed till like 12:30 or 1 o'clock, and then I'd want to sleep in the next day. So the reason why I kind of got back on coffee was because I started having a whole bunch of earlier morning appointments. And I live in Canada where we have Tim Hortons, and to me, Tim Hortons is my favorite coffee. So that was like a reward that I gave myself for going to an appointment, and it helped me to get myself ready and to look forward to the appointment. Like the next day, I would tell myself, okay, I'm going to get myself, a Timmy's. And so from there, I just started getting back on coffee. Now I'm making it at home because I'm trying to save money, but it's just not hitting the spot anymore. So the last many days that I made it at home, I really did enjoy it. It started to bother my stomach. And then this morning I actually got up as soon as I woke up, like I ran out and I went to the drive-through and I got a Tim Hortons because I was interested to see if it was just that I wasn't feeling my home coffee or just coffee in general. So I got a Tim Hortons coffee and I came home and I got back into my bed to drink my coffee and I was looking forward to it, but actually it wasn't really good. I didn't really care for it that much. So, we'll see how things go forward, but so this is a symptom that I'm experiencing anyways, is that food and drink is changing the way that I feel about it is changing. A lot of things I just don't want. What I noticed that does sit well with me lately is fruits. So like really juicy, delicious fruits. I can eat those. And vegetables, like cooked vegetables. I find that cold vegetables not good. Most dinner foods not really good, except for like rice and chicken is going down all right. But so it's an interesting time right now to see like what I can eat and what I can't eat. But I've noticed that I am eating less because I really don't want to, but I have to remind myself to eat because I want to give myself the best chance and I want to make sure that I'm having all my nutrients. So something that I'm continuing to do that I was doing before was like taking vitamin supplements. Chemotherapy can really affect your skin and your hair. So I'm trying to combat that and do what I can. So you might also be looking at my hair and saying, okay, she still has her hair. So I'll touch upon that. When I was diagnosed with cancer, there was a lot of things going in my head and I was processing things. And then when it dawned on me that I was going to lose my hair, that was really upsetting because it just seemed like that just made everything just so much worse. It was just like the last kind of like, I don't want to swear, but it's just something bad on top of it, on top of everything else. It just really seemed unfair because I also learned that in addition to losing the hair on your head, you also lose your eyebrows and your eyelashes. And so I spent some time looking in the mirror, trying to think about how I was going to manage that. I would pencil in my eyebrows. I keep up with the eyeliner, but it was sad for me, and it was very confronting, and I went through that. But then when I learned about the treatment plan, the doctor told me that the medication that I'm on, I'm not expected to lose my hair. So he said that there might be thinning, but I won't be bald. And to me, that was like probably the best news that I've gotten all year about anything in general. Like one of the things that just made me the happiest because for about a month or maybe over a month, I was thinking about losing my hair. I was looking into wigs and how to tie scarves and I was trying to get on board with that and be mature about handling that, but just being told that I wasn't going to lose my hair, it was very, very, very amazing. So, because also before I was diagnosed, I mentioned before that for about 2 years now, I've been feeling off. So I know this tumor has been growing inside of me for at least 2 years now because that's when I've had some symptoms. And one of them was that I really felt like my hair was falling out. I was losing a lot of hair all the time. And I actually brought that issue up to the doctor, but I didn't know if it was like to do with my age or like stress, from working. I work full time. So I wasn't sure, or like nutritional deficiencies. I wasn't sure, but so that is something that I have been going through for a couple years now. So far since I started the chemo, I haven't noticed that I've had a whole bunch more loss of my hair. So hopefully, it continues like this, and it's really having to confront that I was going to lose my hair. It just gave me a lot more gratitude for the hair that I have because a lot of times I complain about my hair. It gets in the way, it gets tangled. I don't like brushing it, I don't like the way that it looks. And but being faced with losing it, now I am trying to like appreciate it and not complain about it anymore. And now I realize how lucky I am. So I'm really sorry for the other people out there that are going through cancer and that they lose their hair. I really have a lot of compassion for that situation. So, anyways, so besides losing my hair, I have noticed some changes a little bit in my skin. I feel like I look a little bit more tired. My under eyes are a little bit darker, um, a little bit more dryness. So, I'm trying to moisturize more. I feel good about taking those supplements though. And in terms of keeping myself together, because when you look good or you feel better, right? So I want to continue to go to the gym. I like to go to the gym. I don't go very often, maybe twice a week, but I want to continue to do that. Not doing any lifting because of my arm, the pick, but lower body and walking. So I'm really going to be trying to do whatever I can, but we're talking about symptoms anyway. So the symptoms that I've had are, I think I mentioned stomach pains. I've been having, sorry, I don't know. I just got a low battery warning. I don't know how that's going to affect the video. So, anyways, I've been having some really bad spontaneous stomach pains, um, which is a little bit concerning to me because now I'm a little bit scared to leave the house for too long of a time period. Hopefully that's going to go away. And a little bit of nausea, I'm experiencing that as well. And besides that, I've had, some dryness on my lips, which is something to be expected. Mouth sores are a big thing that you hear about with chemotherapy. Luckily, I haven't had a problem with that so far. I'm trying to be proactive. Oh my gosh, my cat just jumped up on me. I'm trying to be proactive and keep a lot of moisture in my mouth. And after I brush my teeth at night, I'm trying to switch with like baking soda. So I'm just trying to like keep my mouth clean. I don't know if there's anything that you can do to prevent it, but like I said, I have noticed that my lips have been really dry. So I'm trying to make sure that I'm using chapstick all the time. So I think those are the only things really that I'm experiencing. So like I said, like, for somebody who didn't know that I have a health issue, probably they wouldn't know if they looked at me. Um, which is interesting. And it's made me think too. It's made me think about other people out in the world that you never know what they're going through. Somebody might look normal and you don't know personally what's going on for them. So this whole journey of the cancer, it's very early for me, but it is quite a learning experience for me. So I have developed more compassion and understanding for people out in the world. If I encounter somebody who's maybe in a bad mood or rude or something, instead of thinking that they're a bad person, or that there's something personal about me that they don't like, I'm trying to think and excuse them by saying, who knows, and maybe they got some bad news today, maybe they're really feeling unwell. There could be so many different reasons for somebody to be acting the way that they are. And just because somebody looks good, you don't know what's going on in in their life. And I mentioned that I was at the library, filling out those short-term disability forms, and I had to leave right away. And luckily, the library isn't very close to my house, but I was driving home so fast because I was in so much pain, and I wasn't driving unsafely, but it just calls to mind that sometimes, even if you're on the road and somebody is, speeding a lot, or, like you might think that they're aggressive. I wasn't aggressive, but you never know. Maybe they're in pain. Maybe they're rushing for an emergency. Maybe their child is sick. I know there's been times where my son has called me and he's needed me, and I'm just like in a panic that I have to get to him. And, driving like Miss Daisy is that's not what I'm doing, right? I need to get home. Actually, another story like that is, so I have these cats, and I got these cats because my son really wanted them, not because I'm a super cat person. But I think it was for Easter. I got like some kind of Easter plant. I was trying to be festive at home, and I put it in. I went out one night and I put it in front of the window. It wasn't a night, like in an afternoon. I put it in front of the window because I wanted it to get some more sun. Because where it was on my table, there wasn't any sun there. So I put it on the floor in front of the window so that I could get sun. And then I was out somewhere, and then it just dawned on me because my parents had their dog pass away, because the dog actually got into my mom's purse where she had some Tylenol in a bag, some medication in a bag, and the dog ate it and passed away. And it was a very tragic situation. So here I am out, and it dawns on me that some plants are poisonous to cats. So I did a quick Google search on my phone, and I saw that that plant that I put on the floor before I left is poisonous, like fatal to cats. Um, so when I saw that, I was completely freaked out and panicked. My son wasn't home, knowing how much he loves our cats. I raced home as fast as I could, and yeah, maybe I was a maniac. So with that situation, and with being at the library the other day and and having the stomach pain, it's just it's just a reminder that, and just seeing that, most people wouldn't know that I'm sick right now. So I'm only in the first round. I have 7 more rounds to go of treatment, so I might start looking worse. But it's, like I said, it's just a lesson that you never know what anybody's going through in life. And so when you encounter people in the world and you don't really understand what they're doing, or you might be offended or angry at seeing their actions, or what they're doing, just it's, I don't know, for me it's a good lesson that you really don't know about anybody that you see in this world. And so just be kind, and don't take it personally. Okay, so I think that's all I have to say. Oh, I have one more thing to say. So another big symptom that I'm feeling, and I feel a little foolish to say this because I just started the chemo, so it's like maybe it's not chemo, maybe it's just my brain, but there's something that they say it's chemo brain. And apparently you're kind of like how I am, where you're having a hard time thinking of what you want to say, picking the right words. And so I'm really experiencing that lately. I'm having a hard time sometimes like recalling information. And this is actually pretty worrisome to me because, like I said, I have 7 rounds of cancer left. I'm just going to put them down. I have 7 rounds of cancer left, 7 rounds of the chemo left. And if my brain is already like this, yeah, I'm worried. But so yeah, so besides everything that I mentioned, that's how I'm doing. I'm feeling good today. I hope that I'm feeling good tomorrow. So the next step for me is, I'm going to be getting blood work done, because after each round of chemo you get blood work done, and then you meet with your doctor again, and then so they just make sure that the numbers are what they expect, your body's handling things the way that it's supposed to, before you begin your next round. So I'm gonna try to make a video for the second round to see how I'm doing, how I'm feeling, if anybody's interested in that. But anyways, thank you for listening. Thank you for your time, and I hope you have a great day.